I was able to see addiction in a different light. I grew up in an alcoholic family.
What's going on, y'all? It's your favorite podcast, Built by the Red Stick. Your boy, it's not your boys. Ronnie's sick. He canceled on us today. What a slack. No, I'm just playing. I hope my guy feels better. Listen, we are back with the Get to Know Your Sponsor series, and today we have another Victory Recovery Center employee. We will get to introducing her right after our message from our beautiful sponsors, Victory Recovery Center.
Addiction and mental health don't discriminate. They touch families, friends, and loved ones from every walk of life. For many, it feels like crisis, but it doesn't have to end there. At Victory Addiction Recovery Center, our mission is simple: to save lives and improve the lives we touch. For over 13 years, we've walked with more than 5,000 people on their journey to recovery, meeting them where they are and building a plan that fits their unique needs. Here, recovery is more than treatment. It's compassion, honesty, and perseverance lived out by a team that's both professionally trained and personally passionate. With programs that span medical detox, residential treatment, outpatient care, and specialized support for veterans and professionals, Victory provides the tools, structure, and community that empower lasting change. Victory is more than a center, it's a family. From alumni services to weekly family support groups to ongoing education in our community, the care doesn't stop when treatment ends. The connections built here ripple outward, healing individuals, families, and communities. No matter where you are on your journey, you don't have to face it alone. Victory Addiction Recovery Center is here, ready to help you take the first step toward healing and a healthier future. Because recovery is possible, and it starts with you.
And just like that, we are back. We are excited to have Miss Cherie Hebert. And you are the family.
So I am the family care coordinator, facilitator for our family support group.
Okay.
And I'm one of the residential counselors
Many
at Victory.
hats.
Yes.
Yeah, you always find multiple hats in treatment industry.
Yes.
So,
Yes.
well, we are truly grateful that you came to join us. So thank you for coming to join us. A little bit about us. Me and Ronnie started this probably about a year and some change ago. And we just wanted to highlight the struggles of mental health, the struggles of addiction, and the hope of it overcoming adversity. And so we've had a range of all types of people sit in that chair, and we've had fun doing it. So tell the listeners a little bit about yourself.
So I was born and raised in a small town called Gaydon.
Gaydon.
Or Gaydon, as we call it. I grew up there, graduated in 1986, moved to Lafayette, started college at USL, now UL.
USL. So what? That was University of
Southwestern Louisiana.
Southwestern. Oh.
So graduated in 1991 in Child and Family Studies. My original major was interior merchandising. So totally
switch it up.
Yeah.
I love it.
So graduated in 1991, started working in long-term care. I was a social service director / activity director at a nursing facility in Lafayette.
Okay.
Did that for 2.5 years, did case management for about a year, sold cars for a year. Yeah. Yep.
Did you enjoy the car sales?
Not at all.
That's why it was only a year.
Not at all. Yeah. And then I started working at another long-term care facility and I worked there for 15 years.
Okay.
And then moved on to mental health, worked at a behavioral health hospital for 12 years. In that time, I had many hats. I was initially a rec therapist, did case management, and then became certified in addiction counseling.
Okay.
And then while doing that, I went back to grad school at LSU, got my master's in social work.
Social work club.
Yes.
Okay.
And then in 22, I saw they had an ad for a part-time family care facilitator at Victory. And I had been working with Victory for several years with referrals.
Right.
And so I applied. It was part-time, and I got the job. And a couple months later, they had an opening for residential counselor, and I applied, and I've been there ever since.
So, with your original degree with the family and child services, and then applying for the family core, do you enjoy the family dynamics? Is
Love
that
it.
okay?
Love it. When I worked in the nursing homes, we had a dementia care unit,
Right.
and so I did family support groups for that. And so there's always going to be families, obviously.
Absolutely.
So I really, really love that piece. And even though I had never done it in the addiction field, I thought, I can do it,
Absolutely.
And it's still one of my favorite parts of my job.
And so, with the jump from nursing homes and that type of area to addiction, was there a catalyst that drove you to the addiction field, or was it just a chance of opportunity and then fell in love with it?
It was a chance of opportunity.
Okay.
So while in the nursing facility, we were a nursing home that would take people with chronic mental illness
Okay.
that no one else would take.
Absolutely.
So there was a challenge with the mental health. We did have some people that came in with addiction. So I was a little, familiar in that field. So when I started at the behavioral health hospital, we had a physician who was an addictionologist. And so we got a lot more people coming in with addictions, and they offered me the job, and love it. Never thought I would,
Yeah.
but I do.
It's a crazy world and a realm, but we've talked about it multiple times, and I've brought light to it, and there's been a lot of growth with destigmatizing. I don't know if that's a right context, but I like it. Mental health and addiction. I think that what you do with the family portion of it is a huge part in that, because if we can get the family on board, I feel like the client or patient, whatever you want to call them, has higher chances of success with support.
Absolutely.
But also, not only are we educating them on why, but we're also, I always say, behind every great alcoholic or addict is a even better enabler.
Oh yeah, I'm one of those myself.
Come
or
on,
was. Yeah.
was. And so, tell us a little bit about the service and the family portion, and then we'll get into a little bit more of the therapeutic portion, but a little bit about the family portion of what Victory has to offer.
Okay, so we are definitely family oriented. We just offering the service on Thursday nights has been really huge. I've been doing it, like I said, 3 years. I still have families that have been coming since I started.
Absolutely, yeah.
Because it's just part of their.
And what is that
recovery.
Thursday night service?
So it doesn't replace Al-Anon.
Okay.
But I use a lot of Al-Anon literature. And we just kind of sit there, and sometimes I'll have a topic, and sometimes it's just what they need at the moment. If they just want to talk, and just letting them know that they're not alone.
And that's a free service that
Free service.
Victory offers to the family members currently in treatment, alumni members, or just anybody?
Anybody.
Okay.
Yeah, we're starting to get more people just from the community through churches or other other agencies, but it's growing, and it's really good. It's one of my favorite things.
Yeah, it's a great service to offer. And so the transition, so started part-time and then got the job as a residential therapist.
Mm-hmm.
Where's what's that like? Because I've been in that role.
Okay.
It can be draining.
Yes.
It can be draining. So what's your, motivation to keep going as you've been doing it?
So being able to see their growth, and just, peeling the layers, and when they have that moment of, it's not just about the drug or the alcohol. There's, they get to know themselves, and just, it's just, it's hard to describe.
I get it. I get it. What's your go-to technique, philosophy? What kind of?
CBT,
Okay.
cognitive behavioral, is my favorite. Probably, yeah, I would say that.
What do you think the just for some of our listeners and the people, tuning in, can you in a layman's term explain a little bit what a CBT process is?
So, you know, it starts with our thoughts, and then our thoughts become our behaviors. And so there's a connection. So in order to be able to get through the addiction or the depression or the anxiety, we have to be able to change our thoughts.
Absolutely.
So we can change our behaviors. And yeah, it's definitely one of my.
And do you find, so you were talking about the aha moments, right? And so like I always tell people, and I know Victory is in Lafayette, and a little small community. It's not tiny community. They're smaller, but it's a small community, very local. I always tell people, because like unfortunately in this space, in this world of addiction, especially when you work in it, and even if you're just involved in it, you're gonna see some tough cases and some tough things happen. Relapses, or people unfortunately passing away, or whatever it may be. And I always say, like, because people are always like, how do you keep going? How do you keep going? And it's the lights, right? It's the person that you run into at the store 2 years down the road, and they're like got this smile on their face, and maybe walking with a kid or with their wife or husband, or back with whatever it may be,
Right.
whatever their circumstance may be, but they've rejoined life. Do you have any powerful moments like that?
Yes, definitely, definitely. I've had, when I first started out, as an addiction counselor, I worked in a detox unit. That was tough.
Yeah.
Did that for 5 years. It was detox, leave, detox. Most of them thought I got it. But I can remember a couple of people actually coming back face to face to tell me, hey, I did it. I did my treatment just like you recommended. And I've been sober X amount of, whatever, a year. And then since I've been at Victory, same thing. They'll reach out. I have one man that calls me about every 3 months. Miss Cherie, I'm still sober. So yeah, it's just, it's really, really cool.
Those are the things
Yeah.
that make
Yeah.
that, like you talked about, that light, or that make us keep going and wanting to, because there is so much. I've always said I've never met an alcoholic or addict who didn't have a lot of potential, right?
Exactly.
And I remember, so I'm in recovery. I've been sober since 2016.
Congratulations.
Thank you. And I started, finding rooms and treatment centers and all of that in 2013. And I never had thought about it this way, but I remember I was sitting with a counselor one time, and he was like, we were talking about that concept of alcoholics and addicts being able to light up a room and having all this potential. He said, you ever notice that potential is kind of like a backhanded compliment? Nobody ever says to somebody who's doing really good in life, you have so much potential.
True.
And it always resonated with me to want to, for myself, inspire myself to make sure I fulfill that. I believe in a higher power and all of that. And I think it, my God has given me the ability to be insightful and charismatic and all of these things. And I want to make sure that I live up to his role for me, and also inspire those around me to do that.
Right.
So as your journey and going through, I always like to ask this question. I hope it doesn't, and you can say, I don't want to answer it. Why addiction?
So,
Because,
go ahead.
no,
I'm sorry.
because me and Ronnie have made this comment, and you know, you're obviously a well-educated woman, and could probably be very successful in anything you did. And there's a lot more ways to make an honest life, honest income than dealing with alcoholics and addicts all day. And so it gets tough.
Yeah.
And so I'm always intrigued by people's why.
Okay. So, like I said, when I was introduced to the doctor, Dr. Winston, I was able to see addiction in a different light. I grew up in an alcoholic family. My dad was an alcoholic. He passed away really young in his 40s. Died sober.
Sorry. Oh, well, that's
Yeah, died sober. I mean, he
hey.
had cancer, died sober, and so, I see it now as a blessing.
Absolutely.
My mom became addicted after he passed away, and then my brother is an addict in recovery. My mom passed away a year ago. She was sober. So, but working with Dr. Winston, I just saw I learned a lot about it's not, they don't want to be no one wants to be an addict. They don't wake up and say, hey, I think I'm going to be an addict today.
I want to burn everything down.
Right. So I started learning that aspect, and just it's like you're human, like anyone else.
Absolutely.
That is kind of where it started, and then the more education and the more working, I don't know, it just kind of it's like, okay, that's what I was meant to do.
If you had, one opportunity to supplant embedded thought in all of family members of addict, what thought would that be? If you could teach them one thing about dealing with their loved one, and it be embedded in their brain and they understand it.
So I'm going to use an Al-Anon phrase, saying, and I tell them, I say it every Thursday. You didn't cause it, you can't cure it, and you can't control it.
You didn't cause it, you can't cure it, and you can't control it.
Right.
That's powerful.
Yeah, and that's from Al-Anon.
Absolutely.
And so, and it actually helps me because as a therapist, there's some control there. It's
Absolutely.
like, just do it, So it helps me as well, in professionally and personally, with my family, with my brother who's in recovery. He's been sober almost 3 years. So it's just, I think that's probably one of the things that families need to remember.
Absolutely. So Victory. You're our third guest from Victory, and we've heard some good stuff. So why Victory?
So, like I said earlier, I made referrals to Victory. Always had good feedback from the people that I referred. Just the community, I'd always hear good things about it. And so once I was able to actually become employed there and work with the staff, I have never in my 30-something years of working, have worked with an agency that has such a supportive team. If I need help, the clinical director will be there. The COO will be there. It's not about, that's not my job,
Right.
or letting me drown. It's
Sink
just,
or swim.
yeah, it's just a supportive, loving, caring environment. Everyone that works there cares about what they do. So,
You ever, and of course you probably have, but they have the saying, if one person tells you you have a tail, you might not look. Second person tells you you have a tail, you might want to look. Third person tells you you need to turn around and look because you got a tail.
right.
So, one of the consistent things that I've heard through getting to know Victory through this series has been about the camaraderie and the culture and the lovingness of the staff amongst each other. And a lot of people might not recognize this, but the importance of that is that, for me and my perspective, and feel free to correct me if you have a disagreement. But clients, patients, whatever level of care we choose to identify them as, are some of the most intuitive, and like they've spent their whole life reading situations. And so when they walk into a place, that's the read they get.
Exactly.
And that culture and that lovingness and that family and it's easy to say. It really is. It's easy to say, but it's a unique perspective that's coming from you, is because not only are you part of it now, but something that drove you to be part of it was an external
Right.
person looking from the outside in and getting feedback, and not only getting the feedback, but working with them closely with referrals. Because I understand that process. It's not just this. It's not always sometimes it's not necessarily complex, but
It can be.
it can be. And it's a process, and it's not just as simple as, hey, I got this person, and they're like, okay, come on. So what are some of the things that you like to do on your off time? What's some of the things Cherie likes to do?
So all of my kids are grown. So I'm
All grown
I'm an
kids.
empty nester. My youngest just turned 20.
20.
Yeah. So I love music. I love reading. So music, just relaxing. I don't really, I don't do much.
You ever like to implement a little musical therapy in your groups?
I haven't really done that much at Victory,
Okay.
to be honest with you. I have, but for some reason I just haven't done that. But at my previous job, when I did rec therapy, I did a lot of music and, but so yeah, music is definitely a huge part of my life, and reading and
Favorite
going to
genre?
concerts. So I am a 70s and 80s gal.
Okay.
And really, mainly like rock. I mean, I'm really 80s. I'll tell you that.
Okay.
Stuck in the 80s.
The 80s was big hair rock.
Big hair. Yeah, I had big hair, and so yeah, I like a lot of, but I like a lot of 70s also. Like I don't know, 38 Special, Little River Band. And then in the 80s, it was, Night Ranger, Van Halen, a little bit, just
A
a little bit of
everything.
everything.
I
Yeah.
love it.
Yeah, but I
love
like
it.
country too. I like old country.
Me too.
70s and 80s country.
I
80s
don't
country.
know if I go that far back. Like a little Travis Trent.
Yeah.
Did he go that far back? Yeah. So, I'm all environment, and the more that I've been very fortunate to meet a lot of people. I've been working in the recovery world since 2017, and I've had the privilege of working close to some really intelligent and really bright people that have taught me a lot. And one of the things, and people might not actually, like, clients might not actually pay attention, or the people that are entering treatment might not understand why it. But the psychosocial evaluations, or whatever, BP, biopsychosocial evaluations that people do upon treatment, are always important, because it's taking in all the things from your childhood, your life, and growing up and everything. And so, understanding culture and all of that, what do you think played? Do you think it played a part where you grew up into your caring nature, into your wanting to help nature?
Definitely.
Yeah.
Definitely. I can remember being the caretaker for my brother, who's 3 years younger than me. So I was codependent at a young age.
Yeah.
We laughed. There's a picture of us. I'm 3.5, and he's like maybe almost a year or whatever. I don't know, something like that. 4 and 3, whatever it was. And I have my arms around him, and I said, "You see, I was controlling you back then too. I was codependent back then. I was like, no, you're not leaving." So definitely, the caretaker in me came from that.
If you don't mind me asking, how old were you when your father passed away?
So I was going to be 16.
Okay.
He died the beginning of May, and I turned 16 at the end of May.
And of course, going into the helping profession, do you think that played a role in it, and to that caretaker role that ended up, and by your diagnosis, not mine, a little codependency.
Not little. Not little. Definitely,
Yeah.
definitely. And I learned it. My mom was codependent as well.
Absolutely.
Before she got into into the drugs and alcohol. So yeah, definitely.
It drifted into a little, and like I said, at any point, if it gets too personal, feel free. But do you think so? Have you done work on your codependency?
Absolutely.
Um,
Absolutely.
and do you think that has made you a better or worse clinician?
I think it has made me a better clinician. Yeah. So, I'm an open book. So I quit drinking 11 years ago.
Okay.
Just because I felt I'm working in this field. I don't really care to drink. So I'm just not going to drink anymore. So I quit drinking.
Hell yeah.
I'm kind of like, hey, I'm going to practice what I preach.
Absolutely.
I don't know. And so then the codependency, I kind of work through it, have a therapist. But I actually just started CODA, and I have a sponsor. Codependency Anonymous.
Okay.
Yep.
Yes.
So yeah, I'm really diving into that, and it's totally opposite from what I thought I had taken care of. So it's more of as a parent,
Absolutely.
even though my kids are older, it hit me hard. The control, I was like, I lost control.
Especially when they all moved out.
Right. So, it's really been great.
Well, and just of course, my brain, going places, and I like to explore things. We talked previously before Aaron, or before doing this. You said you have one child who moved away out of state.
Yes.
How did that hit?
So when she moved from Gaydon to Baton Rouge, I thought I was going to go crazy, and I still had two at home. So at first it was difficult,
Yeah.
but when I saw how she thrived, and she's still thriving
That's
there,
awesome.
I was good. She was 8 when I had my second child, so she was like, it
Kind
was
of raised as
it
an
was
only
different.
child.
Right? Yeah. My other two say that she's my favorite, but I don't have a favorite.
It's okay. I tell my mom I'm her favorite, and she's always like, "You're my favorite middle child."
So yeah, she's doing great over there. My other two, well, they haven't found their way yet, but that's okay.
Absolutely. Yeah. I mean, one's 20, right?
Yeah, my daughter, my middle child, is gonna be 24 on Thursday.
Yeah. Well, happy birthday, middle child. I support you. Listen, as a fellow middle child, you're my favorite. Listen, and I didn't even get sober till 26, so I had no clue of my way at 24
Right.
or 20.
Right.
And you couldn't tell me anything. So, and they've got a great role model,
Thank you.
and so little music, little reading. What kind of reading do we like to do?
So I can go for it's mainly mystery.
Okay. I remember you saying something about true crime, which I'm going to have a squirrel moment here. Are you a true crime like movie docuseries watcher? Monsters.
Yes.
Have you watched the new one?
Yes, I have one episode left.
I'm on like 4 or 5 right now.
It's tough.
It's tough.
Really tough.
Yeah.
Yeah.
What? Without spoilers, what? I was watching it, and I was talking about it. I was watching it with a friend, and the concept of like how little understanding of mental health we had back then.
Yeah.
That blew my mind.
Yeah.
Which, I mean, I guess it makes sense because I still think we have a long ways to go in understanding mental health and everything like that.
Yeah.
But yeah, it's crazy.
Yeah. There's one, and I don't want to spoil it, but there was one episode that I literally cried.
Which one was it?
You haven't seen it yet.
I haven't seen it. Okay. Oh man. Yeah, I can only watch like normally, I can binge with the best of them.
Oh, me
I
too.
can. I can. But this one I'm like one episode and I'm like I need a
couldn't do it.
break. I need a break. So, I didn't watch the Mendez,
I haven't either,
but I did watch the Dahmer one.
and I have not, and
Yeah.
I haven't, and I'm like, I don't know, but everybody's saying it's really good, so I might have to.
I thought it was good. Good. So, well, now that I'm done with my squirrel moment, you know, as you're at this what I'll call transitional part of your life, right? Your kids are moving on, and you're starting to look at those. What are some of? Do you have any? Not necessarily even personal goals or plans, but maybe some professional. Where is where do you want to see your career? Is it just continue to do what you're doing, or do you have some things that you want to maybe further education? Is there a doctorate in your future?
No, I love being back in school, but I think I've had enough of that. I actually do some part-time individual therapy.
Okay.
In the evenings, and so I kind of keep that, and I really love the individual work, and that's I think why I love the treatment facility because they're there longer.
Absolutely.
So I really like the individual therapy. So I'm doing that just to kind of get my feet wet. I am gonna be hopefully next month. I think I have a class to become a LCSW supervisor. So that's in the works.
Get you some little.
Yeah.
That's you can treat your empty nest with some little birdies that you're raising in the.
Yeah.
One of my mentors. I don't know if you might know him. He's done some work in Lafayette area. He's in the Monroe area now. Greg Greer.
I think I've heard the name. I'm not.
So, he's always inspired me to seek different modalities. What are there any of new modalities that you're interested in or seeking? Any like EMDR, any of that stuff on your horizon?
Trauma is actually one of the areas that, and I have to watch how I say it because, I don't want people to think I'm weird, but trauma is definitely one of the areas that I like working with.
Absolutely.
EMDR, I don't know. I'm not.
That was just the first one.
No, but that's a lot of people ask me that.
Yeah.
But there is something called, and I may be mistaken, but it's called ART.
So I was spending time with my girlfriend this weekend, and she brought this up, and I hadn't heard about it.
Yeah.
And so I did a little bit of research on it. Seems very intriguing. Accelerated resolution therapy.
Yeah.
Which from what I saw, it took a lot of techniques from EMDR with the eye,
Right.
but supposedly it works a little bit faster.
Right.
So yeah.
I have one friend who was just certified a year ago, and that's kind of how I learned about it. And I've been seeing more and more. So that might be in the works.
And one of the reasons EMDR comes to my mind a lot, 6 to 8 months ago, I had a little mental health breakdown, and like I said, I got sober in 2016, and working the steps and the spiritual program that I work. I always say it taught me to not let the things in my life dominate me, but they still existed. Because I work a 12-step program, and it's very beneficial, and I love the 12-step program. It saved my life. It did. But I think there's growth that happens, and I think being able to explore more. And I say all that on a little side tangent because I ended up recognizing that there was, I guess, little t,
Right.
little traumas that had happened, maybe some complex traumas, and I did EMDR, and the world of it.
Yeah, I hear great things about
yeah.
it. I don't know if it's a fear of mine that I wouldn't be able to follow through. I don't know.
Yeah.
I haven't really thought about it, but I hear great things. I know a lot of people that have gone through the process, and it's
Yeah.
really been helpful.
It was so that when you brought up the art and it came up this weekend, I was doing, like I said, I did a quick little dive
Right.
into it, not too deep, but it sounds very intriguing and very beneficial to the substance abuse community. And I think, I'm all for everybody adding tools to their belt. Everybody.
Definitely.
You know, another question I want to ask as a from the clinician side of your brain, I've asked medical, just people in recovery, all of this, and sometimes I don't think it's as controversial as it used to be. I think it's getting a little bit more acceptable. But from the clinical side, what is your thoughts on medically assisted treatment?
Um, so naltrexone, Vivitrol are the two that and I'm all for that.
Yeah.
I think it's great. Um, the Subutex, the Suboxone. Um, I don't know. I kind of have a
Frillicky
yeah, because I've seen people
misuse it.
misuse it. I've seen doctors prescribe it for years and years and years and years. And then that's a problem.
Absolutely.
So I think if it would be used properly to help someone detox in conjunction with therapy, and then titrate off in a short amount of time, but you just don't see that, or
Yeah.
at least I haven't.
And look, that's the epitome of my perception on it, is that unfortunately I don't think it's been malicious, but I think it's been irresponsible prescription of it, to where, like you said, like and listen, if there's this, every now and then, or not every now and then, but maybe there's a hard case of somebody who just been to 20s of rehabs and just, okay, maybe. But I think it's important to recognize, like you said, and we've had multiple other people talk about it. We had a doctor come on and talk about it. When it's used as an end all be all, that's not a healthy
Right.
manner of its utilization. When it's used in conjunction with a therapeutic process, and I'm of your opinion as well. Like, I want it short lived. Like let's but I'm not a doctor, so
Yeah, me either.
I'm not a doctor. But just from my experience and the things I get to see on a daily basis of people who do get it. So yeah, it's always intriguing to understand the different mindsets and the different thought processes behind
Right.
the new and new trends, I guess is what they would call them, and the recovery world. So, well, before we wrap up, I appreciate you coming and joining me.
Enjoyed it.
I think it's awesome to be able to get to know the staff from Victory that I've gotten to know. I think y'all are doing a lot of really good things over there, just from the people that I've had the pleasure to sit down with. I'm always so I've done some cool stuff in working in the recovery world, from administration side to clinical side, and to watch those two areas at a place like Victory be married together with synchronicity. I think that's the right word. Traveling towards a common goal is a beautiful thing, and it creates a healthy place for people who are struggling to find help.
Yes.
I
agree.
And so before we leave, I always give. I always like to. I guess it's become a little segment. A little motivation from the guest. As a listeners hearing this, and whether or maybe it's a family member, or maybe it's somebody suffering, and they're, at this point where they're like, what do I do? What are some, words of inspiration that you could pass on to somebody who's either struggling or a family member who's struggling?
Just remember, whether you're in active addiction or you're the family, you can't do it alone. You have to reach out for help. Talk to someone. I think that's the most important thing.
Absolutely.
Is reaching out. So
Absolutely.
that's
And also remember that you didn't cause it, you can't cure it, and you can't control it. I like that. I'm stealing that.
okay.
I'm stealing it from Al-Anon.
Al-Anon, yeah.
I would give credit to him. So, once again, thank you so much for joining us. I appreciate you driving out here. If y'all want to, follow Miss Cherie or any of our guests, look up what Victory's doing. If you're struggling with alcoholism and you need treatment, y'all reach out to Victory. You might be able to get Miss Cherie as your counselor, and she can help you. So listen, we appreciate all the love. We appreciate all the support. Do me a big favor. Remember to like, subscribe, share, comment, all that good stuff. And Ronnie's not here to take us out, so I guess I get to do it. But we will be back at the same time, same place, same producer. Built by the Red Stick. We love y'all.